Most of you know Safeway is the grocery store. We're actually bigger than most people think. We have a fairly robust national presence. We have about 200 employees in the United States and Canada. And most of those folks get their health plans through union trusts. So the Safeway health benefits cover about 30,000 eligible employees and their families. So I'm going to be talking about some wellness programs that are available to all employees and their families, and some other programs that are only available to the health plan, and I'll try to keep them straight for you. So I'm going to tell you the story in 15 minutes of how we've evolved to date, our health and wellness strategy and our programs. And to do that, I have to go all the way back to 2005 when Steve Bird, our CEO, who's a very smart business guy, looked at his health spend and trend. We're also self-insured, and said, we can't sustain this. We're a very low-margin business. But instead of just sort of decreasing the benefit or passing on much bigger premiums to the employees that are covered, he commissioned sort of an internal task force, brought in some consultants, and said, what's driving our cost? And probably to no surprise to almost everybody in the room, what was driving our cost was driving most people's cost in health plans. We have a middle-aged population, for the most part, and it was cancer, diabetes, cardiovascular disease, and obesity. Okay. And furthermore, the task force found that these were pretty expensive on a per-person, per-disease basis, and that most people that were had these various diseases were not compliant with basic prescription or primary care. So the initial reason for the studies and for the introduction of various tactics, if you will, was really a very bottom line one. So Steve Bird and the executives wanted to flatten their healthcare trend. That's evolved some over the last few years into being something that they see as of strategic value, not only to their bottom line, because we have flattened our healthcare spend over the last 5 years, but also see it as we've been able to convince everybody there's a top line value here. That this is not only having healthier employees with healthier families is a business advantage for Safeway, especially since Safeway now has very much a strategy to differentiate themselves as a grocery store by the sort of customer-friendly and consumer-directed activities in the store. I've talked to a couple of people here already who say one thing that really knocks me out about when I go into the Safeway is someone just doesn't point, oh yeah, that's down there, but they'll take you to the area, they'll discuss the meat or the produce, etc. And to do that, you need a healthy, sort of present, focused, and engaged bunch of employees. So we've now sort of broadened out why we're doing this from a business standpoint. And like all good retailers, especially grocers, we believe that people should have choice, that in healthcare and wellness terms, that behavior is currency, and that our folks should become educated and more active consumers of both their healthcare and their health. So starting back in 2006, the first thing that was done was a fairly unusual step. All of the health plans that were offered by Safeway Health Plan became consumer-driven plans. But rather than just leave it at that, they really wanted to look at what would create these educated consumers so they could in fact drive their own health and the cost of their own health care. And so Safeway over the last few years has done a number of initiatives. Most people know us for Healthy Measures, which I'll talk about in a minute, which is essentially the biometric testing that we offer every year for free and what we do with that, and the health assessment. But we've also, to the point of culture of health, We've in anywhere where we have a cafeteria, it's not your standard cafeteria. So our cafes use all the behavioral economics and all the same stuff they do on the business side to promote the use, the purchase of, the healthier option. So if you want a cheeseburger and fries, you can still get a cheeseburger and fries at the grill, but it's way over there and it'll cost you $6.78 or something like that. If you want a salad with chicken and all this, great stuff on it, it's under $3. So that's where we put the food. The whole thing has been engineered. So in our cafeterias, where we have gyms, we not only offer machines, but a full programming, and where we don't have gyms, because of course we have 1,700 stores that are spread out all over, we offer substantial discounts on whatever the local fitness and wellness centers are. Smoke-free campus, including, and again, that came early on, including the parking lot, and a whole host of incentivized programs. So I don't have a lot of time. I'll say this. We keep trying different things. We try different incentives. What works best for us, as in healthy measures and health assessment and the MyWell Family Survey, is when it's tied contextually to what we're getting at. So we do a premium reduction if you qualify for healthy measures, and you'll see what that means in a minute. And it's a substantial reduction. So my husband and I save about $2,000, a little more every year, because we qualify for our basic biometrics. That's an incentive. Will it change people's behavior over time? No, not alone. But we do believe that, we want to get your attention. And for our culture, one way to get your attention is in a way that makes sense, to offer you an incentive to try stuff. So premium discount has been very popular and continues to be very popular. And then, like many other employers, we've tried what I call the fun stuff in terms of incentives. And we do have active virtual team challenges and actual team activities, family-focused, including all family members that we'll do virtual raffles with and promote. Those suffer from what we call faster fatigue than the things that we are reducing, your healthcare costs on. We also, and it's not on this wellness grid, we also offer incentives for targeted populations. Someone asked me this earlier. So for targeted populations, tobacco cessation, again, to keep it in context, if you will actively get involved in our telephonic stop smoking program, which is an 8 or 9 module program, we will pay the cost of your over-the-counter smoking cessation aids or your prescription copay, including Chantix, which is pretty pricey, if you choose to use those in the context of your coaching. Diabetes management, same thing. We see these as opportunity not only to target specific conditions, but also everything's an opportunity to do a holistic, assessment with the person about themselves, physically, emotionally, financially, them and their family. So this is healthy measures. It's biometrics. What we've done, I think that has worked very well, is to use this to get people to pay attention. Again, become a health consumer. We give the incentive premium reduction, not if you're perfectly normal, but even if you're in the risk zone, and then we educate you about what's the difference. So you'll see by the metrics here that with the exception of no nicotine use, and we use a swab. 10 more minutes, okay. So you can't self-report that you don't use nicotine, because what we found when we were using the health assessment only is we had the lowest smoking rate in the United States. So we use a nicotine swab. We don't do that every year, maybe every 3. And then the other metrics are really, people can be in that risk zone, and then we know that information actually travels to our main health plan, which is administered by Cigna, where we have a dedicated personal health team of coaches and nurses, and they do outbound outreach based on people who are in that health risk for a particular one or more of those values. Okay, I better move along here. I think I'm good. So anyway, we now, and we're coming up again on what we call our push period, but we've done this 3 times now. So in 2008, late in the winter, we tested for 2009 plan year, and we got a really robust, and again, these are the 30,000 eligibles, not the 200,000, that those we cover, and we got a 70% participation rate. Pretty good at the beginning. Now we have actually over 80% participation rate of our employees. Our spouses or domestic partners are up over 70%. And we've got more and more that are qualifying. You do get an incentive if you qualify for even one. We divide up the dollars so that there's that incentive. In addition, what's very important is that if you don't qualify, if I didn't qualify last winter for this year, and I take it again this winter, and I now qualify, I not only get that premium reduction going forward, but I get a retroactive credit in my last paycheck. Yeah, because we want people to think about it during the year, and we have a whole host of programs I don't have time to talk about, but we want them to have some motivation, extra motivation to do something about it. And here we have, this is a 2-year, those who did not pass in 09, for the 09 plan year, versus that same group passing for 2011 or late 2010. And as you can see, and these were incremental over the 2 years, blood pressure, glucose, cholesterol, tobacco cessation, all pretty good. Weight reduction, okay. Not great, so this is going from 30 or over to under 30. Why have we got a 73% reduction in blood pressure? I'd like to believe it's because people are living healthier lives, but that's the easiest one to scare you, get you go to your doctor and get on a medication. So we do spend a lot more time thinking and talking about weight reduction than we do almost anything else. This is we have a virtual team challenge, the one that tends to get fatigued. But again, what we found is if we can get people to be engaged over time, that they will incorporate this in a more routinized way, sustained behavior, and we get a better trend. So people who are in 2 Jumpstart challenges, roughly a year apart, also the more likely people to continue in the walking groups, et cetera. We've seen a good reduction in that weight. People like our programs, and they agree that it improves their health and that they're likely to participate and encourage their coworkers to participate. So we've been trying to create a more engaged consumer. We want them to optimize their behavior, not just in terms of their own health, but their health care. And we want to transform consumer-focused health plans. Just a little motivation. We do that by sitting around a lot and thinking about what does that mean in a very operational way. What do we need to have people be able to do? And one is to take advantage of our dedicated personal health team and all of the coaching and condition management, but again, also have all of our vendors and providers engaged in taking a holistic look at, what we're doing from a patient-centered perspective. So we've launched a lot of programs that also include transparency tools, and again, I'm sorry I don't have time, so you can get my email and email me, and I'd be glad to talk more about it. What's that say? 5. Oh, okay. Thank you. No glasses on. So we've done a lot of wellness programming, but we also want our folks to understand what healthcare costs, what quality means, And so they can actually make decisions that are based on what their values are. So value-based decision-making in a real way. Maybe you want convenience, so you're willing to pay more for something. Maybe it really is important for you that it have a certain kind of quality, and that quality means your interpersonal relationship with your doctor, or the fact that they have high quality scores, whatever. We want you to be able to access that information and take advantage of it, just not, you know, sort of be passive. So we have done a lot of benefit designs that include copay incentives to drive more educated behavior. We have worked with Caslight Health, which is a startup company that where literally I can go on and to the degree they have the information, which is a whole other problem, I can see not only who's the surgeon in my area who does X, and if they're a man or a woman, but you know what their average, you know, fee is. Okay. We've now launched this for labs. For commodity products, I can now go and find a lab where I'll get the best rate for my lipid panel, because if I don't, I'm going to pay the difference because there's a cap on what Safeway will pay. Colonoscopies, same thing, because there's wide variation. Same thing, costs many tens of times more. So we've been asking our people to get savvy and giving them tools to do that. IO1 is a single sign-on portal. We're launching a wellness page to all employees that has some of the same elements where their world of benefits and wellness are there. Choice Point, this is the reference-based pricing I was talking about. We're moving at the end of the year, same with high-tech imaging, because there's a great deal of price variance with high-tech imaging, but not a lot of difference in, or any difference in quality. On the quality side, I don't have a slide for that. We're piloting what we call our version of virtual patient-centered medical homes, and we have one in Arizona. We're starting one next year in Portland, and partnering with large provider groups and wrapping our telephonic and internet-based services around groups, primary care groups that are doing patient-centered medical home. And we've got a benefit design that makes it very financially worth it for our employees to give that group or those groups a try. This is just a screenshot of MyL1, our portal, and another screenshot of Caslight Health. If you want the slides, okay, done. Wrap. All right. I don't know, are we putting the slides on a website, Michael? Yes, okay. All right. So just to wrap, the last year and a half, we spent a lot of time looking at all this stuff we're doing and surveying our folks, and it was like polka dots. They were interested in it, but they told us, we're confused. There's too much going on. We don't know how to wrap our heads around this. And we weren't feeling we were getting a sustained change in the way people live their lives every day, whether at work or at home. So we not only broadened it out to the whole family in terms of a lot of our promotions and wellness initiatives and to sort of communicate to them, but we actually thought about what do we have to do to really build a culture of health besides brand it, because we love branded stuff. And here are some of the attributes that we came up with. We thought culture is how you get things done around here, and there is a Safeway work culture. So we have tried to use that. But if you look at these, the attributes, all but the last one really are directed at the leadership of the company, the managers, the executives, what has to change in order to have a true culture of health. So that's my last little sermon, is that it's great to have a lot of different programs, but one of the most important things we've learned is that it's not enough. You can incentivize people. It's a good way to get their attention and sort of get them down to that river to drink, but it's not enough. You really have to create an environment that makes it easy to do the right thing and harder to do the wrong thing. Thank you.
For, for your companies, have you ever considered giving information to your consumers, such as what they can do in terms of buying consumer products, avoiding pesticides, avoiding toxic chemicals, things of that nature?
Safeway does that on both the business side and with their employees and their covered health plan. They have a whole a wealth of environmental initiatives, and we're promoting all the websites that we have, as well as and for our retail population, we also do a lot of telephonic and hard copy because they don't work with in front of a screen, but. We're trying to leverage as much as we can to send information. We're looking forward to smartphones and their plans getting super cheap so that anybody can take a break and get messages pushed to them in a very personalized way. And that's what we're starting to look at, including for that.
I would say for us, it's not an intentional part of our programs, but there is already a very high level of awareness around those issues within our organization, given, you know, our ethics around corporate social responsibility and environmental stewardship.
Both of your organizations, I want to thank you for both for your presentations, use incentives and rewards as part of your strategy. And with the Accountable Care Act in 2014, it'll move from 20% to 30% and upwards of 50% of that premium being used for incentives. How does that apply in terms of just your bottom line? Are there tax implications for the utilization of that? Can you talk about that part?
You know, I don't know about the tax implications. Steve Byrd went and lobbied furiously for that increase because he really believes, you know, in incentivizing in a very direct way. So by flattening his health care spend, he didn't save all that money, took it all back. Obviously, he's put a lot of it back into benefits, where we're doing designs and seeing what works and what doesn't work. So I think that that's part of the key. Is we didn't have to go beg per program or per incentive. We were told, figure out what works and what doesn't work, and so that we can keep sustaining this over time. In both the wellness arena and incentives, as well as benefit design, which incentivizes certain behaviors, the globe.
I would just echo that. Same for Aria.
Hi. I have a question about, there's the fear of being like a big brother employer. And did you get any pushback and reactions from your employees about how you monitor? I think you all are trying to work on the positive incentive carrot end of things, but did you get any pushback, and what do you guys do about it?
We always have some pushback. It's not huge, amazingly so. It amazes me. I think because we do give a choice, right? This is none of this. I mean, healthy measures isn't mandated. Our health assessment isn't mandated. It's voluntary. And some would argue, oh, well, if you're giving an incentive, then it really isn't voluntary because if you don't do it, you're going to pay more. But it's a choice, right? And we do have people who make choices, just like we have people who make choices to go and get their preventative colonoscopy in a place where they're going to pay a couple $1,000s over because they didn't go to the place where it's $1,200. So we do have that choice. So I think that deadens down some of it. We also, we have a big communication component, and we're always putting in there, we don't see your individual data. This is what we see. This is where your data goes, et cetera. So as to, but there are people who believe that, who won't take healthy measures because they believe we're storing their DNA somewhere for some nefarious reason. So we always have that, but it's not, it's a very small.
Yeah, last question. I don't know if you can share this information or not, but I'm curious, what is the maximum amount that you will invest in an employee for health and wellness programs who is fully eligible for your programs over in a 1-year time?
We haven't been asked to do that, so I know it's a lot. It's
in the thousands.
Potentially, yeah.
Okay.
Yeah, we actually haven't modeled that as well. We haven't been asked to. We are fortunate to have, as you saw from the slide, relatively low healthcare costs on a per employee per year basis to start with. But I don't know that I could even hazard a guess. We too look at it as an investment, so it's really addressing the cost avoidance. Thank you.